Welcome, welcome. Hey everyone, good to see you all here today. My name is Ellen Block and I'm a sociology professor. I teach anthropology and I'm teaching the global health minor as well. Before we get started being on this beautiful campus, it's important when we gather together in community to start with a land acknowledgement written and approved by our Indigenous Students Association. Both the College of St. Benedict and St. John's University occupy the original homelands of the Dakota and Anishinaabe peoples. We honor, respect, and acknowledge the Indigenous peoples forcibly removed from this territory, whose connections remain today. St. Benedict's Monastery and St. John's Abbey previously operated boarding schools for Native children. Now students, faculty, and staff are working to repair relations with our Native Nation neighbors. It's great to see so many students here tonight, and especially those from the Global Health minor. I don't know how many of you know, but we've only had a minor for around a year and a half, and we already have about 50 students in it. So thank you, everyone, for coming and joining us tonight. I'm very excited to introduce our speaker, Dr. Cheryl Holder, as the grand finale of this year's two-part Peace Studies Conference on the Environment, Issues and Justice, Conflict and Peace Building, a conference in honor of the late Father René McGrath. Tonight, Dr. Holder will share with us her insights on climate change, health, and equity. And before I tell you more about Dr. Holder's many accomplishments, I'd like to thank a few people who made this event possible. Dr. Robert and Lorraine Breitenbucher, whose generous support has been the primary source of funding for 34 Peace Studies conferences, and we hope many more. This year's conference is particularly special as we offer it in honor of the great friend of the Breitenbuchers and the great friend to many of us, the late Father René McGrath, longtime professor of peace studies and philosophy. Funding for this conference was a team effort, so thank you to the Undergraduate International Studies Foreign Language Grant from the U.S. Department of Education that helped us launch our Global Health minor. And it was also sponsored by the Peace Studies Department, the Environmental Studies Department, AfroSTEM, Archipelago Caribbean Association, Climate Justice Club, Global Health Affairs, and the Pre-Med Club. So probably students from all these different organizations are represented here tonight. Now back to Dr. Holder. Dr. Cheryl Holder is a graduate of Princeton University and George Washington University School of Medicine, a National Health Service Corps scholar, internist, and HIV specialist. She served as medical director of one of Miami's largest community health centers and on NIH and CDC health advisory and programmatic review panels. She's dedicated her career to improving the health of underserved populations. And Dr. Holder is deeply committed to community engagement and community action. She's a leader in many initiatives and organizations, including the Green Family Foundation Neighborhood Health Education Learning Program, the Florida State Medical Association, and an initiative she started, the Florida Clinicians for Climate Action, where she works to increase climate literacy and enhance awareness of the impact of climate change on vulnerable populations. Health and its counterpart illness are such deeply intimate and personal experiences. Sometimes it's difficult for us to connect our health to the climate, but in many parts of our country, such as Florida, people are very vulnerable to the effects of climate change. Dr. Holder advocates for comprehensive medical prevention and care strategies for poor communities impacted by climate change. She's a dedicated physician, teacher, and researcher, and her publications and accolades are too many to name here. Please help me in giving a warm welcome to Dr. Cheryl Holder.
Good night, College of St. Benedict's and St. John's University. I am incredibly honored to be here to share some of my stories and hope to call you to action tonight. I did a TED Talk in 2020 March. I prepared for it from sometime in 2019 to March 2020, 1 week before the pandemic. And we were there, and when we got home, we had discussed the pandemic when we were there and what it could all mean and how does that even relate to climate change, because it seems so minor and not quite relevant at the time when we were facing an incredible disaster that the scientists at that TED Talk were all discussing. And you know what happened from 2020, a week after that, what happened to our world. And I hope we can continue to learn from what happened in the pandemic and bring us back to seeing an even bigger, it's impacting us now, it impacted us during the pandemic, and we can get this opportunity to learn from our pandemic and make these changes. I also bring in some information because I always assume my learners don't have enough, my clicker. I like to give them a little background information on climate change. And I always talk with Anna Mae, and you heard about her in my talk. That's not her, but she looks so much like the women that I take care of. And I work in a poor community in the north part of Miami-Dade County, and it's mainly Black women who come to doctors, like everywhere else, more women. And they work hard and they struggle. And I was particularly moved by Anna Mae that day, where I had that aha moment, because she had done, again, that's not her, but she reminds me of her so much. She had done everything best of her ability to stay well. And then, despite it all, she had to seek what she always felt embarrassed about, getting government support, because she was one of these proud Black women who came down from Georgia and worked hard, sharecropping, and ended up with a nice job that gave her some ability, and her husband. And she was at this point where she couldn't survive, and worse, she couldn't breathe. And that led me to start thinking what is happening to our world, because after Anna Mae, I saw the other people. And I had to learn more, because none of this is taught in medical school. I don't know how much is taught here, but what was happening to our planet, I had to start getting more understanding. And I had spent years in environmental justice, because we knew that much of the pollution that much of my patients suffered from came from the injustices of where they put coal mines and where they put the trash and all the other injustices. Yet I didn't quite connect it till Anna Mae came in and I couldn't pay that bill. And I started learning more about the greenhouse gases. From what I've been told, you get a lot of this in your studies, so I'm not speaking to the choir. I am speaking to choir, I'm not really teaching you, but I like to review it anyway for those who may forget that we put out a lot of different particles in our atmosphere that we don't see, but it is blocking our sun rays from going back out, and our oceans is absorbing so much of that and causing the ice caps to melt and a whole lot more moisture to stay into the sky. And much of these things we put out is what made our world, some of the world, and I gotta say the Western world that benefited much from all this innovation, put out a lot of these products. And with that, we see the warming planet. And we also know where it's all coming from. Our transportation industry, our oil industry, our agriculture. And around this area, you have a lot of farms, and a lot of that farms grow products so these cows can eat, and then put out a lot of methane in our health system. And we've noticed this started way back in the Industrial Revolution. So that's how we know that this thing is human caused in many ways. And as an internist, when I see my patients, I say, okay, this is not that hard to understand. Your body, you know about all these heart attacks, right? Your body makes cholesterol. 85% of the cholesterol in your body is what is going to be. It's just your genetics. The other 15% is how much you eat and all the other stuff you do. So that's the human side. So yes, the earth was warming and cooling, was going along fine till humans came along, and just like you may have chosen to eat a little bit too much processed food, a little bit too much pork and fried foods, and a little bit too much, sends your cholesterol up, and bam, you got a heart attack. That's our extreme weather events. Humans played a massive role in what's going on, and now we are dealing with the rise in temperature. And if you look again, how much carbon dioxide we've been putting out in our society over time, from the Ice Age all the way up, all the way up, and then you put the temperature on. So it is clear that we've seen the trending from this little shift over, where we're having fewer cold days and more hot days, and even more recently, like what happened this year, super hot. Now, there's some issues in what we knew that in polluting our environment, this is one of the theories why today is now the temperature modeling is even worse, is that we started cleaning up some of those, remember those fluorocarbons with the sprays that we had, and we stopped putting out all those things, and we changed from our air conditioning. Well, we cleaned up some of the atmosphere enough that now when more sun rays are getting through, and that's what they're thinking is going on, not quite sure why it got so much hotter so much earlier than predicted. But if that's true, then our predictions are going to be even worse for the future. But we know this is our trend. And again, it's the long-term warming of the planet caused primarily by humans. And when we look at all the impacts, we see all the impact here, the sea level rise, the increase, extreme weather. When it rains, guys, it's going to pour because there's so much moisture in the sky. Every degrees rise, there's a lot more moisture. So the flooding is anticipated, we must protect. And you see all the other health issues. And I use heat related because heat is such a stressor on our bodies, at your cardiovascular system, your breathing, you increase your strokes, you get mentally stressed out, and of course it chronically impacts your kidneys. And we've seen increase in our Florida of a lot of hospitalizations. This year, you look at what we say in the heat index. For us in Florida, the heat index is everything, because physiologically, you cannot cool yourself down if your sweat doesn't evaporate. When it's very humid around you, your sweat doesn't evaporate as well. So for us in Florida, unlike other parts of the world, we have to take into account how much humidity plus the temperature. So we use the feel-like temperature. Other parts of the world may just need to use a regular temperature because it's so dry and they know when it happens. But we have had this incredible humidity because the oceans have evaporated so much moisture, and the heat we've suffered this year. We had one death in July of a farm worker, and many, many people going to the hospital. We went through this, and when you look at all the direct impacts, the extreme weather pollution, how many diseases get spread, Lyme disease, which is a problem in this state, will increase. The other things that ticks bring, the Lone Star tick will probably show up more as it lives longer, and everything will happen, and you'll see alpha-gal and many other diseases. Ehrlichiosis, I hear, is already here in larger numbers, and you will continue to see more, not to mention the emotional distress. We know that who gets affected depends on where you live, where you work, where you play, where you worship, and your access to money and power, which drives the policies. And you end up staying well based on what policies you live under and your environment and what we call the social determinants of health. And we know these are the socioeconomic factors. Gene biology only plays a portion. This environment may change as our climate changes. We're going to have a larger number on that. And health behaviors, that's, yes, if you cut down eating fried food and all this, maybe it will help you a lot. But this will change. This was back in about in 2000. But with the environmental changes, this may change. Who's at risk? We know who's at risk. Poor people, children, athletes, elderly, anybody who's going to be outside, who is more subject to having the environment be protective of them. If they don't have that, they will not do as well. Elderly people physiologically aren't able to withstand extra stressors. Also children. Babies, young children breathe at a faster rate, so when it comes to pollution and heat, they are more vulnerable. They're going to incorporate more of the pollution, and also with heat and the pollution, the ozone level increases, which then increases their triggers and dangers to children, and they're low to the ground, and that's where the ground level ozone is. So these are incredibly vulnerable populations. And we understand household income. The richer you are, the healthier you are. I don't care what part of the world you live. The richer you are, the more you're able to adapt and survive any insult that comes at you. In the US, this is a distribution of dollars, so we know based on what we call races and ethnic groups, how the dollar is distributed will tell you how well you will do. So you know who is very, very vulnerable. And when you look at the data again, Low-income minority communities are the highest level pollution exposure. They live in inadequate housing, experience higher energy burden. That is anime, and that's why anime came to me. The Latin population, which is the largest growing population, have all of the risk, again, where they live, where they work, their access to money and power drives their health outcomes. So we're looking at a large amount of risk for the Latin community. And when you look at your US Census, what are you prepared as our next leaders to face? What are the solutions you're going to find? Because we are anticipating a larger burden of adapting to the climate will fall on your most vulnerable, which is the largest group that's happening in this country. Even though the US is still majority white, you will see that the distribution in terms of ethnic group and where they're living have changed, and you're looking at a higher burden on what we will end up having to help. And like I said in my talk, I don't know if ambulance are coming, because so many times ambulance is based on policy. And I bring up policy in 1619, when one of the largest policy change that happened in the entire world was when a group of people chose a continent to find people, take them from that continent, enslave them, and created a second class of citizens that were devalued in every way except for the ability to provide free labor to push an industrialization and change the world. But one of the remnant of that policy is that it did lead to other policies that take this devalued population and place them in areas like in Richmond that redlined these communities that had most the descendants of slaves, of the enslaved people, the African American community, and less investment, less trees, less everything. Those areas are much hotter. I take you to Miami, Florida, where you can look at income distribution, and income is very linked to opportunity, education, and access to the better paying jobs, which had been denied to people based on skin color for many, many years, and has left the population in living conditions that are unhealthy, low economics. This is tree cover. You know where they put trees, not in poor neighborhoods. Again, when you look at air pollution, you see the statistics, and race does not exist. It's a social construct. So what you're looking at, people who we call Black and Hispanic, are truly people who have been placed in conditions that have made them more vulnerable to these health effects. And of course, more people are dying. Again, the environmental factors we see tremendously, and there's the data out of Becker's work that shows that much more so in Black women, the dangers from pollution and heat. No surprise, Black women live in those areas, of course, the preterm labors, and it's contributing to some of the deaths that we're seeing. And even most important is that not just in this country, but globally, the inequities in use of the resources that drives this condition that has warmed our planet is not equal. Most of the people who are using the least amount of energy are suffering the most right now, and this is worldwide. Now, I love this because I want us to get to solutions, and I want us to have time to talk. Because the solutions, just like in coronavirus and any pandemic, is multiple. Think of it as Swiss cheese. I was at the panel earlier, and they talked about what the insurance industry has to offer, what indigenous people have to offer in how we address climate change and all the solutions that came at COP28. And these are all possible, but they're understanding of our personal responsibilities and our shared responsibilities, and getting to the policies that make sure that all these solutions are possible. We have enough solutions right now to slow the warming of our planet. What we need is political will. And with those solutions, we look at equity. And this slide, you guys have seen it many times before. I'm sure that it means giving the people what they need so everybody can see. And if we get to true liberation, we wouldn't even have a fence. Now that's dream but we know we can achieve this. And one of the solutions that you heard about that I proposed and what I work on most of my time is on getting clinicians involved. And because there are 22 million people in that health sector, if we mobilize that health sector, what we can do for the 300 plus Americans to prepare them to be able to survive the climate crisis, especially looking at solutions that get the most vulnerable, means that we will be acting now. Because if we're going to save lives now, we're going to find the solutions that will work immediately. Maybe not in 10 years like carbon capture or a nuclear power plant in another 10, 15 years, but solutions like trees, healthcare, education, which can drive the health improvements. But why is it so hard to talk about climate? How many of you talk about climate with your families? How many of you at the panel, somebody said, activism doesn't mean that we all have to be Greta Thunberg, because all of us do not have her strength and her ability to do what she does. But we can all be activists in some way, and even just talking could be activism. We no longer see climate change that way. That's a polar bear. Yes, that is still happening, but we understand that it's more. And so we want you to talk about it. We know all the scientists agree that climate change is human caused. So when you hear climate hoax, don't believe it. It's human cause. It's like your heart attack has a cause, your stroke has a role that you played on top of what the body was doing. Most people understand that climate change is happening. Most people think we should be doing more. And there are really like 6 Americans out here. There's some that are alarmed, some that are concerned, cautious. I'm pressing the wrong button. I keep doing this. Okay, this one, the dismissive. Don't waste your time, pray, and that's it. Time is of the essence. We have about 7 years to slow this warming so we don't get massive changes of melting everything, having the permafrost go, and having more deaths. Do not waste time with this 10% because the rest will outvote this person. The doubtful 10%, you still have some hope. The disengaged, we can get them engaged, and they're easy to engage because one flood, one hurricane, one extreme weather event, they're engaged. The cautious, these are always good folks because they will give you the balanced opinion and say what the risks are, and they improve your discussion points. And the concerned and the alarmed. The alarmed are definitely willing to act, but they can be very stressful. So I want you to take a deep breath with them. And there's no alarm because we have time and we can make the change. So we have seen a change over time where people are unfortunately getting too alarmed. We want more people to be concerned and less alarmed, but shock and awe, yeah, that can get you movement, but we really want them to get engaged in the process, and we can all do this. Tell your stories. Everybody has a climate story at this point in their lives. Somebody's had Lyme disease in your family. Somebody has survived flooding. Somebody has been in an extreme heat event. Something that you've experienced that you can share. And keep it simple. Keep it local. Keep it hopeful, because it is hopeful. I am incredibly positive because I know that this is possible. When my patients got HIV, how many years ago, I had this one woman who said, I just want to make it to my girl's graduation, and her daughter was about 7 at the time, and the new drugs were coming, and I'm like, okay, let's just try these drugs. Don't miss a dose. Let's just stay together. We're going to be there. Call me anytime. Do what you can. We did that, and the drugs worked because the science was good for the drugs, and I knew this. The girl, she graduated high school. And we were like, yay, she did it. Now it's like, let's just stay the course. You got some side effects, but some new drugs are coming where you don't have to take 5, 10 pills a day. You can go down to 1 pill a day. She's still alive, and her daughter is married and has kids. That's over 30 years. We have 7. In 7 years, we can do it because we've come very far already from folks not believing to most people believing. Now we just got to keep it going. Keep telling your stories. Keep telling how it's happening now, it's happening here, how it's harming our health. Use your data to help you spread the story and spread it. We know scientists believe it. It's harming our health, extreme weather, the unhealthy air. There's a lot we can do to protect the planet. And there's more than humans on this planet, and I want us to stop centering humans as much. So as you bring the talk about humans, talk about the birds, talk about the polar bears, talk about the bees, the insects, everything, because they are part of our existence, and we work together as one. The trees are as important, so we can do this. Here you have hailstorms, I got hurricanes, you have vector-borne diseases. There are other things. Figure out what it is in your area and talk about it. Change is possible. Lots of proven solutions. You can go to Project Drawdown. There are lots of things that you can do when you get your education. And also, what's in it for them? As a young person your age, keeping our planet alive so you can come out and work and live to my age and my mother's age is absolutely essential. Everyone your age must be here fighting for our planet and not to fall for the hoax, not to fall for the delays, because we have solutions now that will work. Clean energy, clean air, we have transportation. There's no reason we can't do electric vehicles. Now, I know everyone's going to tell me, what about the African kids who are doing it? If you're using your iPod or any of these electronics, you're already going into those rare earth problems. But what electric vehicles does is that my patient who lives right next to that highway, no fault of their own, won't get as many asthma attacks because we've cleaned up the transportation system, which were chosen to be placed in Black communities in America, and they're suffering. But in doing that move, we get an urgent response because transportation is a big pollution, a big driver in climate change. Healthy food systems. If we all gave up some red meat, we will decrease our methane production, and all those farms could go back to producing food for us rather than food for cows. So there are so many ways that we can improve our health by adjusting to our climate. We have got to advocate. Students can advocate for climate solutions. You can get involved beyond what you're doing now. Your personal choice matters, but the final choice really is politics. Policy, policy, policy. Had they not chosen that policy in 1619, who knows where we would be today? We can make the change. We are involved in a huge policy issue now around heat, and the doctors are involved, and we're speaking out, we're writing op-eds. Doctors, students can do this. $1 billion worth of disasters. You are going to pay for it. Your generation is going to pay for this unless we make these changes. 2100, this is what's predicted if we don't do it. And that really is Jorge. I talked about him in my talk. He was my patient for almost over 10 years. I met him when he came from his country, and he wasn't fully documented, and so his opportunities were limited, and his family was very dependent on him, so he lived here, and he sold these fruits on the streets. And he did that for many years. His kidneys got worse. The pollution, I think, impacted him because he died from a cancer. But he, like all my other patients, are not asking for charity. They want to help you, and they want you to understand from their lived experiences what will happen with what we're doing to our planet, and to make the change, and to contribute. This was his activism, this was his action when he got interviewed with National Public Radio for me and took them to his home and showed the pictures before he died to say it is possible, and he wanted so much more for his children and for you and the next generation, and it is possible. So this is we incorporate art into what we do, and we had a Haitian artist who pictured how he saw the world. He was an asthmatic, and he suffered many times. And he hoped that this future, that's what he wanted, that we would all be able to go into a world that was clear and helpful and alive. We can act. The solutions are there. You have a voice, but you must voice it appropriately, getting everyone here and looking at the policies that will protect you, protect the people who are most vulnerable, and protect our future. Thank you. Now I take questions. Any questions? None? Wow, you know I'm a teacher. I used to teach medical students, and I always said, can I get permission to ask you questions? Is that okay? Yes, no? I see some yeses over here. Any yeses over here? All right. So how much time do I have? 5, 10, 15 minutes? Somebody tell me, please. I like to end on time also. So tell me, what's one climate action you think that you could make? Knowing your environment, knowing the people, what's one climate action you think? Did I see some nod? I saw nods over here. The young lady in the plaid nodded. Somewhere over here. Or somebody over here was nodding. Or was it back here when I asked permission? Anybody who is nodding over here wants to tell me? Okay, go ahead. I'll repeat it.
I think one climate action that we can take is to vote for people that will support taking action on climate.
Absolutely. Vote for people who will take action on climate. I will throw one more thing in. I am for the more vulnerable population because I think the actions that help the vulnerable will benefit us faster. So you could vote for actions, and there's a big push for carbon capture, which is a machine that takes it out of the air, which is a wonderful concept. There's a big push for the nuclear power, smaller nuclear power, which will work, but that might be another 5, 10 years. So I am definitely for action that will immediately work for the underserved populations, because then I will get it. So I am definitely one for education, a proper education system so people can be prepared to long-term make these proper decisions, because I think being empowered, healthcare access, so then folks don't show up when they are near dead, which then uses a whole lot of healthcare resources. Lots of things to prevent the flooding, a lot more warning, so that folks don't get sick and end up in the healthcare system because of extreme weather. And also anything that pushes for ending fossil fuel use now. You will see your options next year if you're voting in the election, and there'll be Project 2025 that's coming out from one group of people, and that calls for delay in ending fossil fuel use, which it kills you, pollution, it kills your lungs, it causes cancer. So everything must not be in delaying fossil fuel use. So I agree in voting, absolutely. Look at what's harming now, and it'll improve your health. Anybody else? Thank you, sir. Anyone else? Mm-hmm.
I feel like based on the panel earlier, I learned that like a lot of industries and majors, they don't talk about like global business. I'm a global business major myself, and I feel like in our classes it's never talked about. So climate change isn't getting addressed. So global business majors have a hard time learning about it. So I feel like global business needs to have people that are coming in and talking to us about climate change, because businesses thrive on climate, because they can't grow crops without business, or they can't make any money.
Exactly. I'll repeat what she says on this side, that your education system doesn't integrate climate change in all the fields. It's not just separate environmental studies, but it should be in the business section, it should be in medicine, it should be in everything, because it's going to impact every aspect of our society. And I agree, we are pushing in medicine to, and it's been years, to get it in our medical schools. The physiology behind heat and sweating was like this when I went to medical school. And that is so important that patients understand how they get hot and why they pass out and why they die. And also for businesses, you're absolutely correct. If you don't protect your worker, who do you have? And also if you look, when Hurricane Ian went through Fort Myers, it took out Fort Myers Beach. Several of the hospitals basically were shut down. They had to take those patients elsewhere. Not only that, the doctors lost about 1/3 of their patients who had to leave that community. So their business model of having patients and visits totally changed. it increased the respect for telemedicine, which you're seeing most hospital systems are moving rapidly towards, because with every extreme weather event, your patient population moves, you're losing all your business. So absolutely, business should be a big, every area needs to have this education. I hope the provost, I know there's a provost here, so make sure that they understand that you're better prepared, because insurance companies, and the panel, there's a young man who did insurance and he worked with the Federal Reserve. They've abandoned Florida, and now it's the taxpayers who are paying for the home insurance plan called Citizens. If we have 2 or 3 massive events, you saw the $1 billion, the taxpayers in Florida are going to be on the hook for all those homes that we now cover. So it's huge, the predicted loss. Yep.
This is a question, not a response to your question, but I'm curious, like, how much are your patients coming in and recognizing that the health effects they're feeling are related to climate, and how important do you think it is that they make those connections?
Okay, great question. How many people that I treat are aware of what's happening, that climate caused it, and what are they doing, and what should we do, sort of? Well, back then I can tell you, anime had no clue. I really wasn't linking it that way. And most people don't. I remember when it's hot and you get a little angry, did you really think that was a big deal? You just said, oh, it's hot. And I hear it from patients, oh, it's always hot. Yeah, but it's hotter than it should be. And those little extras is what's triggering the problem, especially that our infrastructure is not prepared. So when you're rich, you're in air-conditioned car, air-conditioned house, air-conditioned mall, air-conditioned, so yeah, you feel okay. So you don't get as angry, yet the poorer people living in all that concrete, and at night the heat comes out of the concrete, so you're even hotter at night. Then you don't sleep so well, right? To sleep well, does anybody know the temperature you should have in your room to sleep well? 73 degrees, it's the magic number. 73 or a little bit lower, that's the best number to sleep in. You guys have an air-conditioned world in Minnesota, so I'm sure you're sleeping well. But to sleep well in Florida, you gotta have a lot of money, because to keep your house at 73 at night, you're spending big bucks with Florida Power and Light. So you're not sleeping well, you're not eating well, and you're getting hot, you're getting angry. And I often wonder if the police reaction in some of these situations, because they're hot, because their fabric that I see in police clothes is very polyester. And then they have the bulletproof vests, they're hot. So I'm not surprised that they're always a little bit up. So I think I would personally try and cool my police force, but I'm just one. But I don't think people connect it, just like I don't think a lot of folks connect their reactions. We got heat season finally in Miami-Dade County, May through October. And with that heat season, we were able to put out advisors and we started educating people. And I think that is turning the needle, because our data shows that June and July, we had a lot of ER calls. By the 3rd month of heat season, there was a decline in the emergency, in the EMT calls. So education does work, and having that process really helps people to connect the dots. And we created cooling centers, and we told folks what you should do, and that made a difference. So more and more of us are going to start connecting the dots. I went on Instagram and TikTok to try and get folks to realize that almost everything they're doing is upsetting them. All that pollution causes problems. Allergies. Folks think allergies are minor. Anybody with allergies out here? Yeah. How do you really feel? It's not just a little runny nose. You feel a little bit more tired, a little bit more irritable when this allergy season's. Then you're on all that medication. Nobody planned on being on allergy medicine 6 months out of the year. And that's where we are now. That is slowly, when you connect the dots, why is allergy so much more? Trees, all that CO2 is making the trees grow and flower incredibly. And that's making us feeling sicker longer. So if you have an allergy, a significant other with allergies, and 6 months out of the year they're a little miserable, blame it's the climate. And we can do something about it. Any other questions? Did I answer everything? Yep, here. Oh, Okay, this one, and then whoever said that.
I'm just wondering, because we have a lot of stereotypes here in Minnesota about Florida politics. Do you run into a lot of opposition to efforts to educate your patients about the connection between their illness and climate change?
Stereotypes come often from facts and the patterns that we see in humans. The pattern in Florida is opposition. The governor before this governor refused climate change in any of the policies or in anything we could teach or talk about. It was just not done under the Scott administration, which means millions of dollars were denied to the community because climate change was not part of what Florida politics believed in. The new governor, DeSantis, came in recognizing that there was a problem because it was so obvious, but what the efforts were into what we call adaptation. So there would be money for adaptation to sea level rise, so we got money to raise all our sidewalks. We did not get any money to teach about it and how to protect people's health, because the issue was more on infrastructure and there was no desire to look at fossil fuel. Because if you talk about people's health, then you have to address pollution. So the politics in Florida is not to talk about people's health, but to talk about conserving the trees, conserving nature, conserving the Florida panther, which we're 100% for. But unless you discuss people's health, then you have to address fossil fuel. And so that's how the politics work. The politics now has meant that we cannot talk about equity, nor inclusion, nor diversity. And that's all illegal. So before I retired in December, it was just finding the words. And you see, did I talk about black folks being enslaved in America? Did I even say that? Think about my talk. I've gotten so good at it that I don't even bring up the race because could lead me to suits and all the other problems in Florida. But I said it's okay, I don't really have to bring up the people we call black, because policy is policy. Who you enslave came from a policy decision to choose a more continent that did not have the firepower, and then money and power determines how your policy works. So I could teach the policy without bringing in the race issue, but there comes a point where you can't talk about racism unless you talk about the social construct, and that's now illegal. So it's the facts about Florida and trying to teach this, especially for medical students, where you have to go out and teach and reach everyone. And you see the demographics. So as a doctor, I know what I'm going to go out and what I have to prepare in the next generation. And you talk about businesses. The next business owners have got to deal with the American demographics. So how do we not prepare our folks to say that you've got to be able to listen to your customers. You've got to not use stereotypes, because even though there are patterns of behavior that you may see with a large number of people, does not mean that applies to that person right in front of you. So if I don't teach that, how do you then learn it? Then you make so many mistakes, and it could be dangerous, and we've seen the dangers to people's health. When adolescents show up with an abnormal behavior, what do people think? A young teenager shows up, a little bit off. What do people think, first of all? Could be in the differential. Any pre-meds? This is a pre-med sponsored, so you gotta be thinking about it. Pre-meds out there. A young person shows up, what do you think the first person, an older person, will think? Drugs or alcohol, right? That's a stereotype, that's a bias that we try and teach students. That may be on your differential, but do not close it off, go deeper. Get the full story. Do not assume every young person who shows up who's a little disoriented is a drug-using, alcohol-abusing person, because that's a stereotype that doesn't work. But if we don't get to talk about it, then what happens? It's the same like climate change. We have to look at fossil fuel, and we have to talk about fossil fuel. It's the root cause. So how could we not talk about it? But we can't in Florida. I'm praying that we can vote the next election and folks change, but if not, I'm not leaving. I love the sun. So I'm just going to keep fighting. Any other question over here, right? Any other questions? It was over here. There we go.
So to everything you've said, I say amen. However, there are a lot of folks who would not. And I'm wondering if you have had any success in converting people who you spoke to your point of view, who had come to the conversation not ready to accept or sign on to what you had said. And if so, how did you do that?
Okay. You saw that I say the 6 Americans? I assess where they are. And if I meet one who tells me it's a climate hoax and this, I just let them know I understand how they feel. I understand based on what they've heard and where they're getting their news. I can see where they're coming from. And I hope in time that they will have some understanding and see the suffering and see the facts and hope that it doesn't happen to them. I don't waste a lot of time doing much more on that population. The folks who are on the fence, then I give them more. I find within their stories and within their lives. So tell me about how you've been doing with this heat. What's been happening? How did you feel when this was so hot? What was going on with you? Do you remember it ever being this hot? 5 years ago, 10 years ago. Now, I find for moms, if you did in Florida, if you take your kids trick-or-treating, Florida trick-or-treating used to be cool weather, because I could tell by the costumes. I said, what kind of costumes you know if you have young kids that you're putting on? Do you remember when you were growing up, what kind of costumes did you wear? And invariably, most kids had on those full-length type those costumes because it was always cooler in Florida for trick-or-treating. And now they're still in their little ballerina stuff and all summer costumey looking things. I find the things that they can connect to. I find what's happening to them locally and we talk about it. Then I try and give them as much data. It's not as hard for my poor Black community because they've been living under the highways, they've been living in the concrete, they've been feeling the heat. So they knew it all along. So whose data are you collecting? The data from my community has always told them that something is wrong. They've always been screaming. We had a huge effort for sea level rise in Miami-Dade County for 8 years on the Scott administration, in the beginning on the DeSantis administration. When we finally got the resources through a Kresge Foundation to survey our community, and we said, what is it in the climate that bothers you the most? They said heat. And it was with that large number of data that we were able to get to the politicians and say, nobody is that worried about sea level rise. Yes, it's important, but they're really dying from the heat. And that's when we got movement. So it's whose data you're gonna collect, whose opinion you're gonna listen to. I don't waste time on the ones who are skeptical and don't believe, but other ones, every visit. It's like cigarette smoking. I hope there are no smokers here, but is there anyone willing to admit that you're a smoker? I know, it's okay. Don't, because I want you to stop. So as of now, you're a former smoker. All my smokers, I say, don't worry about it. I'm gonna bother you next visit and every visit, we're gonna talk about your smoking because it is that dangerous to your health. And that's why I'm here as your doctor. So get ready. So they walk in, hey, doc, hey, stop smoking. Dr. Holder, you still bother me. I said, you're gonna be ready someday, and I wanna be here when you're ready. So unless I ask you how I know you're ready. So that's how I am with climate. Until I'm gonna bother you all the time because I know one day you'll be ready, and when you're ready, I'll have the information, I'll help guide you through it. And it's okay. I'm not at all bothered by your staying on the fence because I know the truth and I know the facts. And I know not just because of the science, but I know because for the last 30 years, my patients have been collecting incredible data. And they have been sharing with me with the data every day in those exam rooms. Just because that data is not collected by the esteemed institutions of America and the world does not deny the value of my patients' data. Yes, they're often poor Black women who may not have finished high school. They may have barely literate, but they are scientists in their own right, and they've collected the data from their lives, from their children's lives, from all the times they've taken their kids to the emergency room for asthma, for all the people they have buried. They have good data, and it's with that good data that I say, let us act now, because my patients have told you the truth. Climate change is real. It has hurt them for many years. They are suffering now, but if we act now to help them, it helps you. And we'll survive the climate crisis. Thank you.